To see everyone. Let's see if we can get this shared properly. Does that look like the right slides and not the
That
presenter
looks
mode and all that good
perfect.
stuff? All right, great. All right, so we'll jump right in. You've got a brilliant evidence-based idea. Decision makers want to know what it costs. They want to know what it's going to cost to get off the ground. They want to know what it's going to cost to sustain the idea over time. And at some point, they're going to want to know when they start seeing fewer mice. So we're going to walk through today some of the kind of bare bones, the basics of how to do cost analyses and the kinds of things you might want to think about. So I think folks on this call are probably aware cost shows up in a million different places in implementation science. So you can see it in process models like EPIS. You can see it in evaluation frameworks like REAIM, determinative frameworks like CFR. And listed here are the sort of specific domains within those frameworks where cost shows up. But it surprises none of us that it takes money to make things happen, and sometimes money or a lack of money can keep things from happening. And so these are really important questions for us to kind of grapple with as we think about how to implement new programs. So just as an outline for what I'll be talking about, first we'll talk a bit about kind of the choices that you need to make when you're thinking about doing an economic analysis. What are the first things that you want to kind of lay out before you start diving in with some data collection? Then we'll transition. We'll talk a little bit about how to measure costs and what kinds of costs to measure, and then how to generate meaningful results that are actually going to be useful to you and to your audience. So, choices. The first thing which comes up in this space inevitably is, are we talking about implementation costs? Are we talking about intervention costs? Where should our attention be? And I tend to think of implementation costs are the costs that are going to be associated with launching and sustaining a program or an innovation. And intervention costs are going to be the costs that are associated with the program or the innovation itself. There's good reasons to focus on both of them. And from my perspective, when I'm thinking about these things, I usually actually don't even make a very strong distinction between these things. I think in general, decision makers are going to be thinking about, what is going to be the hit to our bottom line to bring on some kind of a new program. And that's going to include both of these things. So, we can, that you can sort of think them through in an academic exercise, but I don't generally spend too much time, wrestling with myself in terms of, is this an implementation cost or an intervention cost? Um, the next thing, I'd like to sort of just kind of walk through. There are a bunch of different kinds of economic evaluations that people think about, that health economists think about when they're doing economic evaluation work in healthcare. So one would just be a straight up cost analysis, where you're just kind of interested in the cost of a new program or what the budget impact of that new program is going to be when it's adopted. And I think one of the things which is kind of important to note here is that any cost analysis is sort of inherently a comparative exercise. So even if you're sort of just looking at a brand, a single arm assessment, you're always going to be thinking about, what is that's going to be compared to not doing whatever it is you're doing, right? So the status quo is always a relevant comparator. And sometimes the status quo is doing something, sometimes it's doing nothing. But it's always, there's sort of two things that you're trying to think through, and you're trying to think about, when I change this to implement this new program, what is the additional cost or potentially the savings that you might see when this program is in place? So those are just kind of general cost analyses. You might also think of a cost minimization study. That would be where you kind of have the basics of what it is you want to do. Maybe you have your general strategy for implementation nailed down, but you want to figure out, is there a way that we can accomplish the same thing with fewer resources? And so that would be a cost minimization study. Then there's cost benefit analysis, sometimes also referred to as a benefit cost analysis, just because that's usually the order that we put things in when we're doing our calculations. And in these, we're weighing costs versus benefits. And specifically for these kinds of analyses, what we're thinking about is every benefit and cost that we include in the analysis is going to be in dollar terms. So if we were, looking at, a program that saved lives, and saving lives, or improving life expectancy was one of the benefits of this program, we would be putting the life-saving activity or the improved longevity into dollar terms. That's just inherent in how a cost benefit or benefit cost analysis works. But we can think about, and we'll think about as we go ahead, kind of what outcomes and inputs are included in any given analysis. So I'm not saying that life expectancy needs to be in everything, but if it's going to be included in a cost benefit analysis, it's going to be in dollar terms. A return on investment analysis is really just the same uh, economic data presented in a slightly different way. It's a relative change rather than an absolute change, but it's the same ultimate information. In addition, there are cost effectiveness analyses, and a cost effectiveness analysis is usually a cost per some non-financial benefit, non-monetary benefit. And it's usually expressed in terms of an incremental cost effectiveness ratio. And so this would be the difference in costs between two approaches divided by the difference in the effects for those two approaches. Those benefits could be health-related outcomes. In a lot of the work that I do, it's cost per smoker who quits, or cost per person screened for cancer. But you can use a variety of outcomes that would, there are a variety of outcomes that might be relevant for an analysis like this. Implementation-related outcomes could include, cost per additional organization that's engaged, cost per patient reached, cost per equity milestone achieved. I mean, you can come up with any outcome that's of use. The main thing about a cost effectiveness analysis, in contrast to some other things, is by specifying a particular effect, you're sort of isolating the comparisons that you can make. So if I estimate the cost per person who quit smoking and I want to compare that to the cost per equity milestone achieved, it might be $500 per person who quit smoking and $1,000 per equity milestone achieved. But if I don't know sort of if I can't adequately compare those two effects in some meaningful and standardized way, it's not a relevant comparison. So for a cost effectiveness analysis, you would be, comparing different strategies for getting somebody to quit smoking, comparing different strategies for achieving equity milestones, but you wouldn't compare across those two things. If you wanted to compare across those two things, there's a method called cost utility analysis, which is kind of a subset of cost effectiveness analysis. And folks may be familiar with this in terms of cost per quality adjusted life year saved. In international contexts, it's sometimes cost per disability adjusted life year saved. And the idea here is that QALYs and DALYs are sort of standardized metrics of benefit that are applicable across a wide range of applications, and therefore you can make these, you're creating apples to apples comparisons. There are lots of sort of downsides to using those approaches, which I won't get into here, but that is, one important strategy that folks use to have sort of cost effectiveness analyses that are comparable across a wider range of outcomes. Okay, so what sorts of impacts would we want to include in our analyses? So changes in healthcare utilization would be a clear outcome that folks might be interested in. Changes in other resources, which might be outside of the healthcare system, such as changes in the environment, changes in the education system or educational outcomes. You could be thinking about changes in how patients or families or caregivers use their time and invest their time in their health and well-being. Could be things like transportation, how much time, if I require, a particular program requires that people come in for a visit X, number of days a week or, days a month or what have you, that's some time that it takes somebody to engage with that program. And so getting to and from is one piece of that. Paying for the bus fare to get to and from is another piece of that. So these are just, kinds of inputs that one might want to think about in these kinds of analyses. We might also want to talk about changes in productivity. So wages that are lost or gained if you have to, go to a particular program during work. Maybe an intervention reduces absenteeism or, makes it so that folks who are working in an implementation setting can do more with fewer resources. So these are all things that you might want to be accounting for in your economic evaluation. You also want to think about downstream consequences or not. It depends a little bit on sort of who your audience is and what you're trying to communicate. But it is, certainly worth thinking about the things that are happening, not just in the next day or the next week or the next year. Sometimes it's important to be thinking about the next 5, 10, 20 years, or even over a lifetime. Um, Not all of these impacts are relevant to all decision makers and all analyses. So as we sort of work through, proceed in the presentation, that's something to always be thinking about is who is the audience for your analysis? What information did they need to make a decision? Ultimately, an economic evaluation is part of the information that we can provide to decision makers to help them make proper decisions for their organizations, their institutions, what have you. We also want to think about opportunity costs. So these are not necessarily dollar costs that you can easily measure, but opportunity costs occur when you're allocating resources for one purpose, and that usually means that they're not going to be available to be used for something else. So making choices in the face of constraints is something we always want to be cognizant of, and those are things that we can put dollar values on. So examples are, if you're using money for one thing, you're not using money for something else. If you're using, staff for one thing, you are not going to be using staff for something else, or physical space or time or your attention or political will. There's all kinds of opportunity costs that are involved in any choice that one makes, and those are things that could potentially be relevant in an economic evaluation. Um, we were talking a little bit about time horizon before. Some of these constraints vary depending on what the time horizon is. So if you think about having folks who, let's say, in my line of work, we have some number of folks on our team who are smoking cessation counselors, and let's say we have two of them. Then they're either going to be devoted to one smoking cessation program or another. But if I, create a third, then, I'm pulling them away from one of the other two programs. But over a longer period of time, I can hire more people, right? In the short term, these are the folks I have who have the skills that I need. But over some longer period of time, we can bring on new people or we can train people to do new jobs and sort of get past those constraints in that way. Um, Another really key component of any economic evaluation is to think about the perspective that you're taking for your analysis. And that basically means whose costs and whose benefits are we counting? And so the broadest category would be society, a societal perspective. And when we talk about a societal perspective in an economic evaluation, we really mean every conceivable cost and benefit that might occur as a consequence of an implementation or intervention choice. And so there might be benefits to some people, there might be costs to other people, but we're going to look at those on net to see whether there's a benefit that we want to pursue or whether there's a cost we want to avoid. So this is kind of the largest bucket that we can consider as a matter of a perspective for our analysis. We could also take a government perspective, which is not too far off from a societal perspective, but it's not the same thing. Governments do have their own interests and resources. We can think about payers. We can think about providers and other organizations. We can think about patients and clients and families. So then there are lots of different perspectives that we can take, but which one should we focus on? And the key is that they're not always aligned. And sometimes taking multiple perspectives can help identify misalignments and help suggest policy solutions. And so this is kind of a really useful tool in identifying, let's say you do your societal perspective analysis, you see that there is some overall benefit to implementing some new program, but if you take a provider perspective, you find out that it actually costs providers money. And so maybe what you need to do then is figure out some way of subsidizing what the providers are doing from the benefit that some other constituent has and still maintain the overall societal benefit. And then once everybody is benefiting, then you'll have a better shot at actually getting your program implemented. So looking at these broad versus narrow perspectives can be important. That being said, data collection is expensive, and it's not always feasible to collect multiple perspectives. So, as much as we would love to do societal perspectives and be able to look at all of these different constituencies and what their costs and benefits are, that may not be possible. And so when we're doing economic evaluations, it's also really important to think about who your audience is for the work and what information do they need to make the decisions that they're going to need to make in deciding whether to implement this new program or not. So it's just worth noting back in I don't know, so now 30 years ago, in 1996, there was the first panel on cost effectiveness in medicine, in health and medicine, and they recommended that all economic evaluations have take a societal perspective. The second panel on cost effectiveness in health and medicine came out with recommendations 10 years ago. They added health sector perspectives as an additional quote unquote required, but highly recommended perspective to include in any analysis. Um, Again, this is sort of the sort of gold standard recommendation, but it's not always feasible or necessarily appropriate depending on the purpose of your work. Okay, so that's kind of thinking about our choices. Now let's talk a little bit about kind of measuring costs and what some of the challenges are in doing that. So the first thing I want to walk through is something called activity-based costing. The way I'm going to talk about it here is sort of an adapted version of this concept, but it's a fairly common concept in economic evaluation. Um, and there's kind of a multi-step process to this. So the first is you want to identify what it is what is the process, what is the implementation activity that you are actually trying to cost. Nailing that down to sort of be able to draw clear boundaries on it so you know which costs are going to be relevant and which costs are not. And then the next step is to actually map out the activities that are involved in implementing the intervention and and actually doing the intervention itself. And so when you're doing that, you want to be informed by theoretical models of implementation, like we talked about earlier. You want to engage with your stakeholders, your constituents, to find out from them, the folks who are kind of on the front lines of doing the work, what does it take to actually get this stuff done? And you can be relying on things like qualitative data that are describing these implementation processes so that you know who the people are and what the moving parts are that you're going to want to track in your costing exercise. So then you want to identify, once you've identified what these resources are, in implementation science, a lot of times these are human resources. They're not necessarily physical resources, but they can be physical too. And there may be some differences in sort of which resources are present in a research setting versus an implementation or a real world setting, and we'll come back to that in a second. But ultimately, if we're talking about trying to put dollar values onto a person's time, it's essentially, and this is true of all economic evaluation, it's essentially bean counting, right? It's accounting. And so we're saying what the sort of three pieces we want to know for figuring out how much people's time costs is to know how much time was spent on a unit of activity, whether that's a meeting, whether that's a smoking cessation counseling session, whatever it happens to be. How much time is spent on that? How many times is that activity happening? Put those two things together and you get the total time that you spent on the activity. And then you want to multiply that by the price of that unit time, which is a person's wages. You can get people's wages from your HR folks, from the individuals. You can survey them to ask them. You can, what I typically do is use the Bureau of Labor Statistics, has a huge database of different jobs that people have in the US. And so you can get national average values. And that can be more useful when you're trying to sort of disseminate your work beyond your home institution, so that it's a little more accurate and relevant to folks who are working in other settings. And then the total costs that you're going to be adding up are going to include physical and other resources. And so some of those include space and overhead, so office space, computers, phones, all of those good things. Capital resources like machinery and technology, transportation, consumables. If we're doing a smoking cessation study, we might want to be talking about the medications that people are being provided with, So these are all things that are potentially going to be relevant and that we'll want to put dollar amounts to. So to get a little more concrete about this, I'm going to talk through an example study that this was now 10 years ago, more than that, published 11 years ago, but the study was older than that. A smoking cessation study that some colleagues did at Brigham and Women's, and then we did a cost analysis of that intervention. And so the study and the intervention, the study was called Project Click. The intervention was about, we conducted a randomized trial that was evaluating a proactive tobacco cessation strategy that addresses socio-contextual mediators of tobacco use for people with low SES who smoke. So what does that mean? We used an electronic health record-based smoker registry, a registry of folks in the health record who we believe were tobacco users. To identify people in primary care who smoke and connect them with smoking cessation assistance. To do that, we used a system called IVR, interactive voice recognition, also known as robocalling, as well as tobacco treatment counseling and medication, and then providing folks with social supports through a program called Help Steps. And the idea here was that many people smoke to relieve stress. It's debatable whether that actually does reduce stress, but it is a barrier for folks to trying to quit when they're feeling stress in their lives. And so for folks who have health-related social needs, if we can do something to help alleviate some of those stressors, then we might get somebody to a place where they feel like they have enough kind of bandwidth in their lives to address their smoking and attempt to quit. And so that was the idea for this trial. And then we were comparing that to usual care. So the first aim of the study was to test the intervention, test its efficacy and its effectiveness. And then secondarily, we conducted this economic evaluation. And so this is kind of a generic, a loose process map of what was going on in the study. So the first thing we needed to do was work with our IT staff. They were going to be helping to program the electronic health record so that we could identify the folks who we thought were using tobacco. And then the IT staff were also programming the IVR system so that it would call the right people and it would draw on the information from this registry to make the calls. And so then the IVR system would reach out to a person it thought might be a smoker. And that person would say either, actually, I'm not a tobacco, I haven't used tobacco in years, or I never did. Or they might say, yes, I do. I don't really want to quit right now. Or they might say they were interested. And so if they were interested, then they would be connected with a cessation counselor. And the cessation counselor would find out, offer them tobacco cessation counseling. If they wanted medications, then the counselor would reach out to the research assistant who then shipped the medications back to the person, the participant, the study subject. And then the counselor would also talk with the participant about this Help Steps program and connecting them. Basically, what Help Steps was is a software platform where folks could identify any particular health-related social needs they might have, whether it's access to education or physical activity resources or home repairs or you name what something could be. And Help Steps would connect folks with resources in their area near where they lived that could help them out with those things. So these are all the moving parts. Oh, and the last thing was that we also had somebody who was working with the cessation counselor and the research assistant to sort of troubleshoot, make sure everything was going okay, talk about difficult cases, et cetera. So there was some supervision involved as well. So these are all the different things that we were trying to cost out in the course of this study. So what were the costs that we wanted to actually measure? So first, we wanted to talk about startup costs. What does it take to sort of get this thing ready to go in the first place? So for that, we're talking about the registry development. So that's the IT person's time, the IVR equipment. That's a physical resource that we needed to buy, training the counselors, getting some other equipment. I think that things like, headsets for the counselors to use on the phone, logistics setup, so coordinating, setting up systems so that the RA could coordinate with the pharmacy on shipping things out, setting up a database to track the calls. Any program you've got going and you're reaching out to people, you need to know who you've talked to already, who's where in the process of the intervention, et cetera. There were scripts and materials that needed to be translated from English to Spanish. Sometimes you need regulatory approval, particularly if you're going to be messing around with an electronic health record and things like that. You need to test all of this out and make sure that it's working properly before you roll it out to your target population. So, and then if you're doing this as a proper implementation costing exercise, you're going to want to be thinking about some of the planning that's involved in this as well, which is not something we did in this specific analysis, but the mechanics of estimating these costs is the same, whether it's intervention or implementation costs. And then there are ongoing costs. So there's things like equipment maintenance, paying for the phone lines in the office space, the time that it takes to reach out to patients and get them to participate or invite them to participate, the time involved in counseling and supervision, in record keeping, in actually the time, the cost of obtaining and shipping the medications, subscribing to help steps. These are all examples of things that would be included in this kind of economic evaluation. All right, so these are all the things we want to measure. And now how do we actually go about doing it? There's a bunch of different ways. So the first would be something called microcosting. And when we talk about microcosting, what we're talking about is trying to track individual activities and the time that it takes each time you do a specific individual activity. And there are some, a variety of reasons that that might be useful, which we'll talk about in a second. And here, in sort of order of precision from highest to lowest, are different ways that we can actually go about measuring time use. So one would be automated tracking. So this is where you have some task where, let's say you're doing it on a computer, and each time you click enter, it timestamps your actions. And so you can use those timestamps to measure how much time somebody is engaged in a particular activity. You can also do direct observation through actually observing somebody with a stopwatch. That tends to be pretty resource intensive, sometimes invasive. Both of those two things can be fairly accurate. You can also ask the person who's doing the task, how long does it typically take you to do it? Or if that person is not available, you could ask somebody who's familiar with the task and see and get a sense from them how much time it takes to do something. So those are all approaches to microcosting. Another approach is called macrocosting. And with macrocosting, we're not trying to figure out the cost of doing every little action that a person might be involved with in an implementation effort. We're trying to think of what their overall time use is. And so for that, we can do things like use administrative records and look at the number of full-time equivalents of effort that a person is devoting to a task. So if we think about our smoking cessation counselor in Click, we might have said, okay, well, our counselor is working on Click 3 days a week over the course of 6 months. And so we know what our person's annual salary is. And so we can figure out the cost of their participation and engagement in the study in that way. So there are a few things to consider in weighing off these two different approaches. Microcosting can allow us to get more accurate task level costing, of course. And it's actually really useful for measuring uncertainty. So if you measure how long a counseling session takes and you measure it each time a counseling session happens, some are going to be a little longer, some are going to be a little shorter. You get, you can calculate a mean and a standard deviation there, and that can be useful. Microcosting is actually also really important in the context of equity-focused implementation and intervention work because, an example I like to give is, let's say, we're counseling somebody with limited English proficiency versus somebody who has higher English proficiency. And it's going to take a bit longer to counsel the person with limited English proficiency. And if we are just looking at the macro costing, we're going to miss that level of detail. And it might be really important for us to understand kind of what the resources necessary are, what are the resources necessary to ensure equity, for example, to make sure that we're devoting enough money to the effort so that everybody can be treated equally. Macro costing may be more feasible. It can be more accurate in the absence of objective task-based measures. Um, it can be difficult in some what I have called here partial FTE cases. So, if we think about our counselor, maybe 60% of the counselor's time is supposed to be devoted to their counseling effort on this particular project, but sometimes it's a little more, sometimes it's a little less, sometimes it's there are activities that might or might not be related to the implementation effort, and it can be kind of hard to know kind of where to draw the line for those kinds of things. And just sort of as an FYI, Click was macro costed. And then you might, ideally we're going to do our work here prospectively. We're going to collect our data prospectively, but that's not always possible. And so sometimes you might need to examine costs retrospectively. That's obviously, there's a little more opportunity for error there, but sometimes that's, all you've got. And so Click happened to be a retrospective analysis. And then lastly, it can be challenging to isolate time devoted to specific tasks. We got at that a little bit with macro costing, but you could also think of it in the context of the time stamping exercise. Let's say I start my activity, I hit enter on a particular task. My colleague comes over and talks to me for 10 minutes, and then I finish the task after my colleague walks away. And so 10 minutes of the time that I've now sort of that I think is devoted to a particular task wasn't actually devoted to that task. Some part of that time was, chatting with my colleagues. So these things aren't perfect. We sort of do the best we can ultimately. Okay. The last thing is to focus on the largest and most salient costs first. So, and you can do this with stakeholder guidance. And, an example I give is I had a research assistant at one point who was costing out individual sheets of paper. That was not necessary. It was not the biggest cost driving our analysis. Things like IT programming time, testing, those kinds of things can wind up being much larger and much more important costs. Things that happen over and over again that are expensive, or that happen once that are very expensive. Those are the things where you're going to want to focus your efforts to get the best estimates, and you can sort of focus your research resources on those things and not worry about the small potatoes. Okay, so what cost estimate should you use? Context matters. So one choice would be you're measuring costs in the context of your research study, so you can get a good and accurate estimate of what it costs to run your program in the research setting. But you might also be interested in how the cost is going to be implemented in the future using a budget impact analysis. And there's a trade-off here. So on the one hand, if you use the cost from the research setting, you're going to get a very accurate estimate of what it costs to achieve the evidence-based effect. So we've measured a certain cessation improvement in cessation rate in our smoking cessation study. That was something we achieved in this specific research context. We know how much it costs to do that. But then if we go and do this somewhere else, we might staff it a little differently. There might be other factors that change how the program is implemented in some other setting. So really what we're talking about here is what are the core aspects of the intervention and what are the adaptable aspects of the intervention. Sometimes you can know that, sometimes you can't. And so if you're thinking about how something's going to be implemented in the next setting, which is really, I think, where most of this effort is relevant, there are going to be some changes there. And, when we make those changes, we might not get the full research estimated effect that we measured in the trial. So how do we manage that? Essentially, we make our assumptions clear. If we're assuming that the effect is going to be the same in the future setting as it was in the research setting, we need to say that. Or we could say, we're not sure, but maybe let's just, for the sake of argument, guess that it'll be 90% as effective or 80% as effective. And as long as you're very clear about kind of your assumptions when you're doing that, then that's going to be relevant information for your decision makers. So ultimately, what we want to be doing is sensitivity analyses. So what do we want to include or exclude? Research costs should be excluded from our analyses. Anything that you're doing that you wouldn't be doing in a real world setting, you're only doing it because you're collecting data for research. The effort involved in that, those research activities are not costs that you would include in your economic evaluation. Um, that can sometimes be tricky. The example I give is, if we think about the supervisor in the click research setting, when they were having those meetings between the supervisor, the RA, and the counselor, um, part of that conversation was troubleshooting the counseling and how the intervention was going, but some of it was how's data collection going? How are we doing with recruitment? And those kinds of things are research activities, not implementation and intervention activities. And so figuring out where to draw the line with those things can be tricky. But again, we sort of try to be as transparent with those things as possible and make our best guess. Um, Planning the implementation of a program should be included. I think as we've sort of talked about already, it's not always clear where planning starts. So sometimes, we might want to distinguish strategic planning, the kinds of planning that happens on a regular, let's say every 5 years, we try to, vision what our organization is going to be doing. That's different from planning, okay, we've decided we're going to implement Project Click. Now, what do we need to do to get that off the ground? That kind of planning is what we want to include in these economic evaluations. Some additional considerations, there can be a learning curve, right? So sometimes folks are going to get more efficient at a particular task as they do it more. The opposite can also be true. There can be fatigue related to implementation where people were initially energetic and gung-ho, and then over time either lose that enthusiasm or competing priorities come in, and so the ability to sort of sustain an initial level of engagement may not be consistent over time. But these are things that you can sort of either collect data on, or you could model and make assumptions about. You want to think about the resources that are already in place when the implementation begins. Is the implementation as it was done when you were collecting data, are the sort of baseline resources available the same as they will be in some future implementation environment? And so think about, in the case of Click, we already had an electronic health record in place that was collecting data on folks' tobacco use. Maybe in a future setting, there's an even better system, and they have much more accurate records of people's tobacco use. And so, that's going to change what the costs and benefits are in that setting. So you want to be thinking about those kinds of differences between kind of where you're at baseline. And again, we want to make the reporting and our assumptions as transparent as possible, and that way, any assumptions that we're making can be evaluated. And making these kinds of things transparent then also allows stakeholders and decision makers to say, I see, you're using a particular input. I know that things are a little bit different in our organization, so I'm going to tweak that input in your economic evaluation so that the numbers we generate from this are relevant to our institution. I'm going to try to move through this fairly quickly. There's always going to be some uncertainty in anybody's estimation. There's stochastic or sort of natural variability. We talked about that in terms of the length of counseling sessions. In an evaluation where you have many inputs that have some variability to them, you can use techniques like Monte Carlo analysis to sort of bring all of that variability to bear in your final estimates and come up with a confidence interval for your cost estimates. There are other kinds of uncertainty, which are sort of what I call fixed sources of uncertainty. So choices that might be made differently in another setting or under different assumptions. And so these are kind of standard sensitivity analyses where we might look at best case and worst case scenarios. Best case, the cost is as low as this. Worst case, the cost is as high as this for some particular input. And you would vary these things over a range of values for an input of interest, plausible values that you think are relevant for a decision maker. And you can also be thinking about specific alternate assumptions. So maybe a change to workflow or a change in a funding source or a change in where you're acquiring a particular resource that's going to alter the cost in a particular input in your analysis. So those are things that you can play around with in your sensitivity analyses. And I always, say a well-crafted sensitivity analysis is the best defense against unprovable assumptions. So if there's some number that you have or that you need and you don't know what it is and you have no way of knowing what it is, if you do a really well-crafted sensitivity analysis, then people are going to be able to sort of make use of your evaluation and estimation even without that certainty. This is just a couple of examples of where we used a Monte Carlo analysis to generate this. These are essentially, you can think of these as ways to generate confidence intervals. So these are cost per quit estimates and willingness to pay thresholds, and for a different smoke and cessation study listed here. And what these analyses allow us to do is to say, okay, well, if for my organization, our willingness to pay for this new implementation effort is $4,000 per additional person who quits smoking, there is a roughly 50% chance that this intervention or implementation strategy is going to be cost effective with that at that willingness to pay threshold. But if our willingness to pay threshold is higher, if it's $8,000 per person who quits smoking, then we're, maybe 95%, it's 95% likely that this intervention is going to be cost effective at that willingness to pay threshold. This is a sensitivity analysis that we did in the same study as the previous slide. And in this case, we were comparing two smoke and cessation strategies, but we also wanted to compare to usual care, which we didn't measure. We didn't get an estimate of what the smoke and cessation rate was in the usual care population. So we got an estimate from some external data, but it wasn't from exactly the same population that our research was done. And so we wanted to see sort of, how does the cost per quit vary if that usual care quit rate was a little higher or a little lower. And so that's sort of what we're looking at along these curves here, from a sort of conservative case to a best case, and our sort of base case in the middle. I want to actually right now kind of switch to a really cool multi-way sensitivity analysis. And now, actually, I'm going to skip this. I'm going to skip the multi-way sensitivity analysis in the interest of time, because I see we're coming close to the end of the hour, and there are a few closing thoughts I want to get to. But if folks want to take a look at these QR codes, the center QR code here is for a calculator that a postdoc of mine, Natalie Smith, developed for the same project that I just showed on the previous slides. And what it does is it allows a user to play around with different inputs that are relevant to the cost analysis and see how each of those things changes the total cost and the total number of people who quit smoking in a particular setting. And so this allows an end user, a future user, to say, okay, here's what things look like in my own environment, and I can play around with these different inputs and see what the impact on the outcomes of interest are, the total cost and things. So the calculator is here at the center QR code. There's a paper describing how we came up with the calculator. And then on the left here is another paper that Natalie and I wrote about budget impact analysis and how these kinds of analyses can be useful to folks who in their decision-making processes, and why budget impact analysis is really useful in the context of implementation science. So I do want to sort of transition to closing thoughts here, so we have a little bit of time for questions. So first of all, as we've discussed, are your settings comparable? When you're thinking about the economic evaluation that you've done and how relevant it is going to be to a future decision maker, are we making apples to apples comparisons about, what we estimated and what their interests are? Or, is the setting where they're going to be implementing this program different in important ways that we need to be aware of and think about? Are the populations and stakeholders and organizations comparable? Is the smoking prevalence in this population the same as the smoking prevalence in the next population that we want to do this work in? And that's something you can play around with in that calculator as well. And think about what the time horizon is that might be relevant for a stakeholder's decision making. Are lifetime costs relevant for a particular decision maker or not? Is it really only going to matter sort of what this costs in the next year or the next 2 years, because that's as far out as our budget goes? Or do we need to be thinking about sort of what the costs are in 5 and 10 years, because there's going to be some long-term impact on budget that folks need to be aware of? So always, it's going to be important to be thinking about that with the decision makers for whom the analysis is being prepared. And so just to wrap up, prospective data collection is always going to be the sort of best and most accurate way to proceed. Obtain the stakeholder input. Always, always, always. This is really going to make your analysis, as valuable as it needs to be and as accurate as it needs to be. So get the information that's most relevant for decision making. Make sure that you have accurate identification of workflows, and that you're able to focus on the most impactful costs and benefits so that you're using your sort of research time wisely, and focusing on the things that are going to be most useful to your audience. And so lastly, this is a QR code and a link to a web page run by some colleagues at the VA. It's basically a website that has links to a couple of dozen papers, maybe 3 dozen papers. They're all, sort of really helpful for anybody who's kind of starting out in this work, and even folks who are sort of more intermediate and beyond. So there's just a really great set of resources there. And so with that, I'll stop and we can have some time for questions and things.
Awesome. Thank you. That was really helpful and a really nice comprehensive introduction to a lot of the different concepts that seem important in this space. So, we've been getting a couple questions in the Slido, and I think there's really two themes of questions that I've been seeing. One is maybe in the bucket of advice for people who want to either learn how to do these types of evaluations a little more or figure out who people are who can help them with these types of evaluations. And so maybe I'll start with, say advice. This is one from Becca, like advice for an implementation science researcher who wants to include cost estimates in their work, but really doesn't have an economics background, maybe beyond the resources you just shared from the VA, where else would we start?
Well, so I would start there. I would say, if you have the time and the resources, there are lots of short courses that are available from different organizations. So I think Harvard has one, ISPOR, which is, I'm going to botch the name of the organization, the International Society for
Pharmacoeconomic
Pharmacoepic.
outcomes of research. Yeah,
There you go.
I'll help you.
So ISPOR has some short courses. WHO even has some short courses. So there are, opportunities for that kind of, uh, relatively low key training, assuming you don't want to go and get a PhD in these things, or even a master's. But and actually, one thing, which, let me see if I can pull this up, because in addition to the papers that are in the the web page I had in the QR code, there's also a paper that a colleague of mine, Andy Eisman, published like this month, which is a really great kind of way to start thinking about cost analysis. And so the link is now there in the chat if folks are interested. And I would say in terms of people, if you're looking for colleagues to do this kind of work, looking at the authors of those papers is probably a pretty good place to start as well.
Okay, that was great. Maybe a related question that also came up a couple times, which is, basically, what is kind of the simplest economic evaluation or a minimum economic evaluation that you would typically recommend, say, in implementation science for a grant?
Um, I'm not sure I can answer the question. I mean, I think it really it depends on a million different things. It depends on sort of, you know, what you're trying to accomplish. Obviously, you know, I think for me, when I'm doing an economic evaluation, the top line number is almost as hard to, takes as much effort and know-how to estimate as anything, more fine-tuned than that. So when I'm doing a paper, if I'm the shortest version of this, I'm going to publish a number of, saying what the total cost of implementation was or the cost per person who comes through the program might be. But then I might, want to dive in more deeply and say, okay, well, what if, this was run for 2 years or 5 years or 10 years, or what if the population looked a little bit different, or the patient flow was different, or we staffed it differently. And those are kind of the sub-analyses that I would, start diving into. But you know, it really sort of takes all the same inputs to generate those outputs. And the hard part is, putting all the numbers together in the first place. So it's kind of hard to say that there's a lowest common denominator analysis that I would recommend.
That's perfect. Yeah. No, I think it's helpful to sort of think about everything that should go into it and not just try to look for a shortcut. So I think that's great. Um, we have time for another question or two. I'm happy to take more from the chat unless someone wants to take themselves off. I see Steve just did.
Yeah, great talk as usual, Doug. And every time I hear this, I learn more. I guess one thing I would ask is how you think about the really tricky issue of not just implementing something and the costs associated with the costs of sustainment, and whether you've kind of delved into that. I mean, and I'm partly reflecting. I mean, if Kelly was here, Kelly Ashburner, she would say, in this study we're doing looking at sustainment, the number one thing that came up as the either the facilitator or the barrier to long-term sustainment. It is cost and the revenue that's needed to pay for that. And sometimes it's direct, Medicaid, et cetera. Sometimes, though, it's enveloping the thing in existing services. In other words, layering it into something that is already in place that is sustainable. That gets really tricky if you try to cost that out. It's kind of an indirect. But are you beginning to think about the costs of sustaining implementation at all, and how that looks? Because I'm sure that's the next frontier for you, among many.
I, I mean, I think what you're talking about is almost different from an economic evaluation. It's about how something gets financed, right? So where can you find the resources? This is about saying what resources do you need to do the work. It's up to you to find them. And in work where we've talked to folks at FQHCs, they've told us, well, we can sustain this as long as we have a grant. So much of the work that they're doing, they're applying for one grant after another. And, sometimes that means that they can sustain something over time, but sometimes it means that every, implementation effort is only as long as the grant lasts. And then once the grant is gone, the support is gone and the program is gone. And, we heard from them, they sometimes they cobble it together. Sometimes folks are kind of sneaking the activity into their workflow, even though it's no longer sort of part of their paid job. So those are kind of the extreme scenarios where folks are really trying to scratch together an implementation effort, absent some other kind of financing. But I think those are more strategic decisions than they are estimation problems.
I guess that's true, but it's a hand in glove, right? You got to know what your costs are that are embedded in sustaining something and what that means, as opposed to implementing something, but sustaining it over time and re-implementing. So, anyways, the work you're doing is really important. I mean, it is a
It's true, and I think it may be an opportunity for you to use these tools would be that the cost of implementation might be affected by the financing mechanism. There might be more waste involved in one financing approach than another, and so these kinds of analyses can help inform that and say, hey, look, if you really want to do this as efficiently as possible, here's the best way to finance that, and use that as kind of leverage in motivating decisions.
Thanks.
Okay, great. I think we're basically at time. I might just go ahead and say to wrap up from here. So thank you so much. This was really, really great. Um, I learned a lot, so I really appreciate that. So just a reminder, we hope to see many of you